Hello, I'm Dr. Amaka Uzu. I'm a consultant family physician here at Bahrain International Hospital, and we'll be talking about diabetes today in participation of the World Diabetes Day. So thank you so much for giving me the opportunity to talk about diabetes. It is such a vital topic to discuss, to make aware to the public of what this condition is, ways we can, improve our health just to avoid getting diabetes in the first place, and also, finding out how we can invest in our health just so we can enjoy a healthy well-being. So diabetes basically means when you have high sugar levels in the blood. So now the causes of diabetes will be clearer once I explain how we develop diabetes. So we have an organ in the body called the pancreas, and this organ is a small organ that sits just behind the stomach, and this organ produces insulin. And insulin is a hormone we have in our body that helps regulate the blood sugar. So what insulin does is it absorbs the sugar levels in the blood and takes it into the cells, which is now used up as energy. And so what happens with diabetes is we categorize it into two major types. So we have the type 1 and the type 2. So for type 1 diabetes, you find that the body is not able to produce insulin in the first place. So when there's no insulin, which is the hormone I mentioned about, then you now end up with high sugar levels in the blood. Then for type 2 diabetes, is the body is not able to produce enough insulin. So there is some insulin, but not enough to help regulate the blood sugar. And in another situation, it does produce enough insulin, but the cells are not reacting to the insulin's function. So that means it is resistant to being able to regulate the blood sugar in the body, and that way you end up with high sugar levels in the blood. So the symptoms of diabetes could vary, between type 1 and type 2. But commonly, you find that patients will complain of being excessively thirsty, so having to drink lots of water, or having to pass urine more often than normal. Some patients will notice that they're losing weight without any explanation. Some patients feel really fatigued and tired most of the time. And sometimes they are prone to infections, especially fungal related infections. And sometimes when they have small ulcers or wound, they find that it doesn't heal properly. So, but the difference between type 1 and type 2 is that for type 1, these symptoms tend to happen very quickly for patients that have type 1 diabetes. While type 2, you find that it is a gradual progress really. So the symptoms do take time, and it's when the sugar levels are really quite high, they start to experience such symptoms. So diabetes could cause a lot of damage to the organs in our body. So the way I try to remember it or educate patients on is, if you think about it from the head down to the foot area, we'll start with the brain. It could lead to things like stroke, for example, and the eyes, it could lead to visual loss, some people even as severe as blindness. It could affect the heart, so people end up with heart conditions, some people end up with heart attacks or problems with the vessels of the heart. It could also affect the nerves in the body overall, which leads to lack of feeling or poor sensations in the body, which can now progress to when you have ulcers or wounds, you don't even know when that happens, and that leads to problems on its own. It can unfortunately affect the kidneys as well, and sometimes, like I said, you're prone to infections where you get really ill quite often. Yeah, so there are ways we can diagnose diabetes, but the two main ways are either doing you do a urine test along with blood test. Sometimes you do a blood test where you have to fast for at least 8 hours, where we check your fasting sugar. And there are blood tests where you check your levels for over a 3-month period, which kind of gives us an idea of what your sugar levels are. Then the urine test is also a useful test to check the sugar in the urine. Well, the treatment for diabetes varies really depending on the type of diabetes you have. I mean, the type 1 diabetes, the main treatment is insulin, and like I mentioned earlier, because the body is not producing enough insulin, you need that in the body to be able to regulate the blood sugar. So your patients end up with insulin for the rest of their lives, and which is like an injection that they have to give themselves. Then type 2, there are varied options, so depending on your sugar levels, some patients don't necessarily need to go on medications. So there are ways where they can try to change their lifestyle, which would include balancing their diet, so healthy diets where you have low carbohydrates, you have protein, reducing sugar, salt in the diet. Regular exercise as well would help, and trying to maintain an ideal body weight. So with that in mind, if you have sugar levels that are not too high and you try to make those changes, then that could keep your sugar levels under control. But some patients unluckily would develop a high level of sugar where not only do they have to keep a healthy lifestyle, they now end up with tablets where they take to help reduce the excess sugar in their blood. And in some patients who are on tablets, they're still having high sugar levels, they have to include injections like insulin. Yeah, so this is quite an important question, and for type 1, unfortunately, it's one that is out of our control because it's due to an autoimmune condition where the body's defense system attacks the cells that produces insulin, so that's why the body doesn't produce enough insulin. So such patients have a genetic predisposition, and it's commoner with the younger age group for type 1 diabetes. So in this type of diabetes, you continue with a healthy lifestyle, but it's not really going to make a change. You still have to go on to insulin for the rest of your life. But type 2, which a large percentage of patients develop type 2 diabetes, I would say 90% of the population develop type 2 diabetes. This is very important to know that there are ways we can prevent it, which I mentioned earlier, which is trying to have a healthy, balanced diet, trying to exercise regularly. We advise at least 5 days of exercise a week, and you build up gradually to that level of exercise. And each time you exercise, you try and do at least minimum of 30 minutes of exercise in a day, and also that would help you achieve an ideal body weight. And if you keep to that, then you might not end up developing diabetes. And for those who have been given the diagnosis of diabetes, you can actually prevent yourself from going on to medication or for the sugar levels getting worse by keeping this healthy lifestyle as well. So it is preventable, and that's why we're here to discuss this with the public, make you aware of investing in your health, trying to keep a healthy lifestyle so that way you prevent yourself from developing type 2 diabetes.